Hi everyone! Today my friends and I will be sharing with you more about UNSDG3, which is good health and well-being of people in Indonesia. UNSDG3 exists to ensure a healthy lifestyle and to promote well-being of people of all ages in Indonesia. The general trends and efforts that have taken place are: great progress against several leading causes of death and disease have taken place, life expectancy increased dramatically, infant and maternal mortality rates have declined, combating of communicable and non-communicable diseases, which can also be seen as HIV and malaria deaths, have halved, the promoting of reproductive health, and the improving of the national health insurance, which is also known as the Jaminan Kesehatan Nasional coverage. We have also compiled a few facts and figures to give you a better view of what the situation is like in Indonesia pertaining to their good health and well-being. Firstly, at least 400 million people have no basic health care, and 40% of citizens in Indonesia lack social protection. Secondly, more than 1.6 billion people live in fragile settings, combined with weak national capacity to deliver basic health services. Thirdly, 21.7 million people living with HIV were receiving antiretroviral therapy. However, more than 15 million people are still waiting for treatment. Next, every 2 seconds, someone aged 30 to 70 years old dies prematurely from non-communicable diseases such as cardiovascular disease. And 7 million people in Indonesia die every year from exposure to fine particles in polluted air. And lastly, more than 1 of every 3 women have experienced either physical or sexual violence, resulting in short and long-term consequences for their physical, mental, sexual, and reproductive health. The objectives of this UNSDG are as such. Generally, universal health coverage will be integral to achieving this UNSDG. They will try to put an end to poverty and reduce inequalities. There will be emerging global health priorities, the acceleration and improvement of community nutrition, the improving access to quality basic healthcare services, the increasing of effectiveness of drug and food supervision, also the availability, distribution, and quality of health human resources, the strengthening of healthy lifestyle movement, which is also known as Gerakan Masyarakat Hidup Sehat, and lastly, the enhancing of management and research as well as health information systems.
Let's look at the major reforms in Indonesia. In 1919, we have decentralization, and in 2003, we had the public sector reform, followed by the medical education, and last but not least, a national strategic plan that took place from 2015 to 2019. What are the achievements towards the UNSDG so far? Firstly, we had the Central to Primary Healthcare Strategy, and Indonesia managed to provide high levels of basic utilities and equipment, as you can see by the statistics below. We also have community-led early detection, monitoring, and follow-up of NCD risk factors. So Indonesia managed to deliver basic immunization system. Some of the projects that led to the success for the sustainable goals would be the Healthy Indonesia program, which was a national strategy to develop healthy communities with access to care, and it consisted of the paradigm of health, primary health, care strengthening, national health insurance, and the decentralization of the program, which was the locally led programs and the community partnerships, including water and sanitation services for low-income communities. We also had the TB program, where there was public to private coordination, and this allowed the TB mortality rate to be reduced by half. Another major contributing factor would be the JKN, which is the Jaminan Kesehatan Nasional Health Insurance, which was implemented in 2019 as a plan to cover all citizens by health insurance by 2019. And prior to the launch of JKN in the early 2014, Indonesia had already 4 large health insurance providers that were managed by governments at the central and local levels, namely Jamkesmas, Jamkesda, Askes, and Jamsotec. The integration of JKN with private business was also part of the plan. So Indonesia wanted to integrate Jamkesda into a single national health security system from 2015 to be completed by the end of 2016. And an essential element in achieving this is actually to involve and coordinate local governments to link the existing Jamkesda's program, the JKN, and pay any of the costs not already covered by the central government, and to facilitate the participation of citizens who can afford to contribute to this insurance and to ensure the availability of functioning health facilities at the Regency. As you can see by the roadmap provided by the Indonesia's government, by 2014 to 2019, they will conduct the socialization, education and advocacy and implement all activities agreed in the roadmap. And BPJS Kesehatan will transform into Jaminan Kesehatan health insurance by 2019. The reforms needed to make JKS successful was to develop proper healthcare service facilities, strengthen the referral system, and the instituting accreditation and standards for medical care to maintain standards of healthcare service facilities, to improve human resources in the healthcare, and to develop the pharmaceutical and medical devices sector, drawing up standards and costs of healthcare rates, and to introduce relevant regulations. But we can see that despite all that has been achieved so far, there are still some challenges that Indonesia's government face. One would be the quality of care. There was limited data to measure the quality of care, and despite establishing policies on quality and safety of healthcare, implementation, monitoring, and evaluation of their impact remains weak. And existing evidence suggests that anecdotal evidence such as low QOC, quality scores low in public and private facilities were recorded during the ANC, and there was poor service readiness for immunization, and there was limited capacity of puskesmas to serve the needs of managing ICDs. There was also a problem with the maternal mortality and also the child mortality. Equipment was also part of the factor that remains a challenge. There were 90% of medical equipment were imported, and there were lower equipment ratios compared to most developing countries in Southeast Asia. So we can see that the major problem is, I think, is the advancements of technology and also the access to proper medical equipment and the latest medical equipment. I feel that the core thing that will allow Indonesia to flourish in their healthcare system would be churning more resources and budget to technological advancement and research and development. This will allow them to have quicker access to equipment needed and also quicker access to the latest equipment, and also allow them to discover more in the medical sector, and also in this way they are able to cater to much more and larger scale of people and at a faster and more efficient rate.
Okay, so now I'll talk a bit about the changes that was brought by COVID-19. So first is the economic stimulus package that was introduced by the Indonesian government. This package is split into 4 different parts. First, it's on the healthcare sector. The government pumped in 75 trillion rupiahs to purchase medical equipment, such as like the PPEs and other medical equipment that are important. There's also an incentive given to healthcare workers, such as doctors, nurses, and other frontline workers, to incentivize them to help out in this critical period. There's also subsidies of the Social Security Agency premium given out to people. Second level is social protection. The government pumped in 110 trillion rupiahs to help over 30 million families in Indonesia, 10 billion of which falls in the Family Hope program, while 20 million families falls in the Staple Food program. The social protection also covers a thing called the Electricity Relief Scheme, which I'll share a bit more about later. The third part of the stimulus package is the tax incentive and credit for businesses. Here, the Indonesian government pumped in 70 trillion rupiahs to help workers in the manufacturing sector who earn less than 20 million rupiahs a year, and they'll be exempted from the income tax for 6 months. Additionally, import tax payments will also be deferred, corporate income tax will be reduced from 25 to 22%, and debt payments for microloans will be extended by 6 months, and there'll be an acceleration of VAT refunds. The last level is the Economic Recovery Program. The government plans to pump in 150 trillion rupiah to help credit restructuring and financing of small and medium businesses. Next is the Electricity Relief Scheme. The Indonesian poorest household will get free electricity and discounts to help them cope with the economic shock caused by COVID-19. The state-owned company PLN would supply for 3 months starting this April, and 20 million households which falls under the 450 volt category will get free electricity, while the 7 million household that falls under the 900 volt category will get 50% off of their electricity bill for 3 months. This will cost the government over $223.5 million. Next, on the non-physical measures, there will be a reduction of certain import restrictions, there will be an accelerated import of medical devices and PPEs, and the national logistic ecosystem is to be improved. The banking and financial sector, 1 year of postponement of credit and leasing payment for loan up to 10 billion rupiahs for MSME, and informal workers, and there will be a postponement of credit and leasing payment without ceiling limits in accordance with debtors' ability to pay, and this covers SMEs and non-SMEs. Finally, here are some of the things that our friends from Indonesia have to share about the COVID situation and how they're dealing with it in their country. And with that, that's the end of our presentation. Thank you.